WCCS 101.1 FM, AM 1160, and WCCSradio.com. On your Wednesday morning, there is something new around the neighborhood. It's called the Indiana Care Network, a new business. And here to talk about it with us today is Melanie Ludwig, who is a nurse practitioner, and Dr. Bruce Bush is with us as well, former CMO at the Indiana Regional Medical Center. Our conversation this morning is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Morning, folks.
Good morning, Todd.
It's good to have you both with us here today. Dr. Bush, you were telling me you have 3 locations. You began a few months ago.
Yeah, our first day operating under our tax ID number was August 22nd. Mm-hmm. And we have practices, the pre-existing practices in Blairsville and Bolivar, and we started a new practice in Blairsville.
Yeah, and it's called the Indiana Care Network. Melanie, what's your involvement?
I'm a nurse practitioner at the Blairsville Clinic.
At the Blairsville Clinic. Mm-hmm. Okay, we're going to need to get you a little closer to the microphone and pretend you're yelling at Dr. Bush. Get out your big voice here this morning. That microphone's a little quieter than the other one. The clinic's in Blairsville. That's within the IRMC at Chestnut Ridge Building, correct?
That's correct, Todd.
Yeah. And what's the connection with the IRMC, or is there one?
Well, there is a connection because the 2 offices in Plumville and Bolivar were IRMC physician group practices prior to them being transferred to our ownership and operation. This is all an effort on the part of the hospital and this new company to preserve and enhance primary care in the county. So our model takes us at some point down the road towards becoming a federally qualified health center. And federally qualified health centers operate primary care practices of several different types, and they get enhanced reimbursements from the government for all Medicare and Medicaid patients, as well as eligibility for large yearly grants, which would help us at some point to provide enhanced services to people who may not be getting much medical care at all.
Yeah. And those locations, they're pretty key, aren't they?
Yes, they're typically in rural areas because those are places where patients are usually more in need.
Mm-hmm. Yeah. Melanie, let's talk about some of the services that folks can expect to get with the Indiana Care Network.
Well, for the most part, we're really well about being holistic. We like to look at a little bit of everything, what you need emotionally, physically, and if we can help you find services with other people, we like to guide you along with that.
Mm-hmm. Primary care has a specific definition, does it not?
It does, but it all depends on who you talk to. When it comes to nursing, like nurse practitioner like myself, we are more holistic, but we're all the base. We're kind of like the basement of your house. Without a good basement, the rest of the house doesn't stand really well. So we are the basement to get you to the best health that you can be between the two of us. It's a negotiation. We don't expect you to have to do certain things, but we negotiate to try to get you the best health that you can.
Yeah, yeah.
Melanie's specialty is family medicine, and so it encompasses care of all sorts of issues that people might have, everything from coughs and colds to diabetes, arthritis, heart disease, all sorts of things.
Yeah. There are folks, plenty of them out there, who really just don't have any relationship with a physician or a care provider at all. And especially, as you said, when you get to rural communities, transportation could be an issue, just the no desire to go to the doctor, nobody pushing them to the doctor as we might think that folks have somebody within their family says, you got to go. And it seems as you get more rural that it becomes more common, doesn't it?
Yes. And there's also a lot of, I guess, misinformation. They think you go there and you have to do medicines and you have to do this. That's where the negotiation part comes on. We're trying to get you to your best health that you can participate in. So we'll order tests. If you don't go get them, I can't help with that. So it's a negotiation to get them to the best health that they want to participate in. If the medicine doesn't work, we'll try another medicine. It's kind of like I said, a negotiation, trying to get them to the best place they want to be.
Yeah, yeah. Yes, and there is a certain amount of reluctance to try this or to try that, and certainly we saw with the pandemic there were many people who were reluctant to try any sort of course that was recommended because they just weren't sure. When there's uncertainty like that, people tend to sort of back away, and we don't want that. We want people to be having regular doctor's visits and being right on top of their health, because why mess with your quality of life, correct?
Right. And you mentioned transportation might be an issue, but cost might be an issue for a lot of patients too. And this model gives us the resources to help with transportation, to help with food insecurity, to help with places to live in some cases, as well as getting people connected with insurance. And if they're not eligible for insurance, then we can help with a tiered fee schedule based on the income that they have.
Yeah. How many people are involved in the practice?
Well, right now we have one nurse practitioner at each location, and typically we should have 2 staff with them, although Melanie's a little short right now. So if there's anybody out there who's looking for a job in a medical doctor's office, we have some openings in Blairsville.
We don't want Melanie to have to always wear those platform shoes. If you're a little short right now, Melanie,
I am a little short.
you'd like some help with that. Days that you're available, hours, and those sorts of things?
Monday, Tuesday, Thursday, Friday, 8 to 4, Wednesday, 10 to 6, so that people that are working have a chance to get in without having to leave work.
And that's at all 3 locations?
That's Blairsville.
That's Blairsville.
Plumville's
They,
7.
They're 5 days a week, but they have slightly different hours. I think Plumville opens a little earlier and closes a little earlier.
But they have a larger farmer population, so they like getting up at the dawn and getting out a little earlier. So
They have a very large Amish population too.
Yes.
In that neighborhood. As I know, I live in that area, and all my neighbors are Amish. So that is a different atmosphere in which you're dealing.
There's still a hitching post out in the Plumville office.
Well, you need one.
Yes.
You need one there, and so that serves them and helps their needs as well. When we think about the way that you avail yourselves of services, do people need to make appointments? Is it walk-in? How do you work all of that?
for the most part, it's call and get an appointment. That way we can get you scheduled best. We're not hurrying. I don't want anybody to feel like they're rushed. I want you to come in and have the time you need to tell me what's going on, what you need, what I can help with. And if we just had walk-ins, then that kind of creates like rushes.
Yeah.
And I don't want that. So right now, I think most of us will get you within 24 to 48 hours an appointment.
Yeah.
And we'll see you and try to get through what we need and work with your schedule too.
It's called the Indiana Care Network, and Dr. Bruce Bush is with us, along with Melanie Ludwig, who is a nurse practitioner. And as we've been hearing about these 3 locations, are there plans to expand to more locations in the future?
At some point, I think that potentially all of the primary care practices owned and operated by the hospital will become part of Indiana Care Network. It's also likely that all of the OBGYN practices will come in as well, because the government considers them primary care.
Oh, okay.
And that would help financials for the hospital in the long run, because all of these practices are subsidized to some extent, but with enhanced reimbursements from the government programs, that can go way down.
Yeah, yeah. Would folks want to get established even though they might not be having a particular health concern right now? Would that be a good approach?
Yes. It's always better to start before you have a problem. Just like you shouldn't wait to get a mechanic till the car broke. Then you have to wait till they can fit you in. If you get established and you do your yearly checkups to make sure everything's going okay, do your every couple year labs, make sure everything's in the right direction. When you need me, I'm there, and I already know you. Whereas if you're waiting for an emergency, then we're all stuck in the middle of a bad situation, and it doesn't usually turn out well for a lot.
Yeah.
So it's easier to start whenever things are going well instead of waiting until they're going badly.
Just like your car, that regular routine maintenance, and maybe a lube oil and filter too.
Yeah.
Not a bad idea.
I would second that, Todd. And for years and years, I didn't have a primary care doctor of my own.
What?
Which, yes, I'm admitting to it.
Oh, no.
But as I got a little bit older, while I was still working, I got to thinking maybe that's not such a great idea.
Yeah.
So I got myself established too.
It'll catch up with you eventually.
Yes.
And we don't want that to happen. So for somebody to get established, for someone to make an appointment to come see you, what should they do?
Just give us a call. The number at the office, at the Blairsville office, is 724-459-1790. Give us a call, leave a message. I'll call you back. We'll get you in to get you seen.
For folks to get hooked up with one of the other offices, what should they do for that?
You know, they have their own individual numbers, Todd, and I don't have them at the tip of my
I didn't
tongue
bring
right
them.
now.
I am so
But
sorry.
the other thing they can do is they can still call the number that's associated with IRMC Physician Group, and they'll transfer to us.
They'll get you there.
We have a good affiliation with the hospital, which will be ongoing pretty much forever.
Terrific. Hey, it is so good to have you with us. It's so good to have your organization working here in Indiana County and beyond, too, because those are really border areas. Bolivar's, that's Westmoreland County, and certainly Westmoreland County plays into the IRMC Chestnut location, and Armstrong County can play into the Plumville location. So you've got a wide net that you've cast already with only 3 locations, so more could be coming. Thank you again for both coming in to visit with us today.
Oh, thanks for
Thank you for
having us,
having us.
Todd. We appreciate it.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.